evening, Dr. Tijjani Hussaini, and welcome to the Big Idea Talk Show. I am so happy to host you tonight, and I'm very happy. I heard on the news some days back that the NCDC recognized Kano State as the state with the highest number of COVID-19 tests. Kudos to you, kudos to the entire task force team on COVID-19 response in Kano. Thank you so much, sir, for a job well done. Now, the index case for COVID-19 was recorded in Kano State on April 11, 2020, and within weeks we were recording numbers as high as 300. Doctor, can you tell us what is the outlook of COVID-19?
Kano, just like you mentioned, within a very short time, we started with 1, then 3, then 6, then the numbers kept increasing over a very short period of time. Within this period, from 11th of April to yesterday, that's 28th of June 2020, we had 1,200 cases confirmed. And this we have tested over 10,000 people. The community testing approaching almost 13,000 people that we've tested. And within this period we discharged almost 783 cases. 866 cases, and we have 283 still on treatment. Unfortunately, we also recorded about 51 deaths. It has been eventful. The last couple of months, about 3 months or so, was demanding. However, looking at what we've achieved in Kano, I would say it is a tremendous success, and this is not unconnected with the support we have right from the Executive Governor of Kano State, Dr. And for those who have been following events over media, he has been in almost every activity we have done. He has supported us with moral support, financial support, whatever support you can imagine. Otherwise, we will not have achieved the success we have achieved. So also the task force chairman is the Deputy Governor of Kano State, Nasri Governor, also was of immense support. His a pillar to the entire response. And also looking at both the task force and also the technical response team, because we have two arms: the task force, which is overall policy and have oversight. You also have the technical response, those that go in the field implement every bit of the response, which I had.
Thank you, sir. So basically, how contagious is COVID-19?
For COVID-19, I would say scientists have what they call They are not. How much an individual can infect
other people.
Basically, yes. So depending on different modeling, whether there is observation of total of the lockdown, for example, with observation of the social distancing, with putting of the face mask, hand hygiene, and so on and so forth. So how much a person can infect others depends on this factor, and it ranges from 2.9. That is without any form of protection, no lockdown, no social distancing, no putting on of face masks. So one person can infect 3 people. But with social distancing, with face masks, this reduces this infectivity.
Yes,
reduces. It can be as low as 1.
Okay.
That is one person infecting
another one
person instead of without one infecting about 3 people. So this varies actually.
Okay, thank you, sir. Now, Doctor, how was sampling conducted in Kano?
Initially, what we've started was people sitting in their homes calling us through our call center. They will call and say we have a suspected case in either that individual or a relative or a neighbor or some other people. Gradually, we moved on. Then we have what we call, even now we have what is called rapid response team. As soon as we receive that call, we deploy the rapid response team to go and take samples for testing. And if it comes out, we now say one is positive, then we transport for isolation. Kano is a city and a state of over officially 30 million people.
Yes,
so you imagine the number of rapid response team you require to do this all over Kano. So we now said perhaps we need to improvise. We need to
narrow it down.
Yes, so
something more effective.
This is something more effective. So we set up sample collection sites. Apart from the RRT, people can go to a site and say, and also take their samples.
Voluntarily, they can walk there.
Voluntarily, they can walk in there. And if they have a suspect also, you can also go in there and ensure that his sample is collected. These sample collection sites go pari passu the RRT. We have not disbanded the RRT, but they kind of also work together. So we established about 10 sample collection sites all over Kano. They are in Kano Municipal, for example, in Nasara Hospital. There are also some are in Murtala Specialist Hospital, some are in Wazir Shukia, that is along Kasana Road, and so on and so forth.
So they're all in the metropolis?
Yes, some are outside of Kano. For example, we set up another sample collection center in Rano. So some are outside of Kano. So, but again, we thought then we need to also move closer to people, that people don't need to travel to a distant place. But we also introduce another strategy, the community sampling. Instead of people coming, we move sample collectors to those communities. And this is how we selected these communities. In Kano, there are LGs with the highest burden. Kano, Municipal, Taro, Nina, Sarawa, Unguku, Wali, have the highest number of cases. So we set up camps, either in health facilities or other public buildings, where we deployed our sample collectors and our team. They sit there and people come within those communities to submit their samples. So again, just like the RRT and sample collection points in health facilities, these 3 things coexist, and that is why we have the highest number of collections
and samples
tested within the last 2 weeks. For using this strategy, we were able to collect over 5,000.
In 4 days?
4 days we collected over 5,000 samples, and they have been processed. And again, because of we want to reduce transmission, there are well-established facts that we are in community transmission phase.
Yes.
If you want to stop this transmission, one must pick both symptomatics, those who are exhibiting symptoms, and those not exhibiting symptoms. That's the asymptomatics. So it's only when you pick both symptomatics and asymptomatics that one will be able to stop the spread of this infection. And this is what effectively we are doing. We are testing, we are ensuring that people who have COVID are detected, are isolated, are put on treatment early enough before they continue to transmit.
How closer has the experience with COVID-19, the pandemic, edged Kano State and Nigeria at large towards, health and research economics?
Research in most developing countries is, I would say, is not a priority, but has very low priority.
Yeah.
Investment in research, especially in Nigeria, is a bit on the low side compared to developed countries. However, during this pandemic, because this is something new, coronavirus, COVID-19 is new. Yeah. It's a novel coronavirus, so not much is known about it. So this prompted us as a response, as also a state, to ensure that we also contribute to the body of knowledge.
Yes.
That has taught us. We created what we call the research pillar that deals with the research. So for now we have an ongoing researches, about 5 or 6 ongoing researches, so that we also contribute to the body of knowledge. So for me, I would say, yes, we might not have moved as we would have wished, but again, we have moved ahead.
Now, sir, as the former director, Public Health and Disease Control, Kano State Ministry of Health, and now the Executive Secretary, Primary Healthcare Management Board, so you bring to the COVID-19 task force a wealth of experience. So in the course of the response in the states, are there healthcare facilities at the PHC, state or federal level, whose capacity have been upgraded, or they are earmarked for upgrade for better service delivery, as it were?
One of the most important features of this COVID-19 response is the level of capacity building the response was able to. But because it's still ongoing, is able to impact. Over these 3 months, we've trained more than 5,000, 6,000 various levels of manpower in terms of infection prevention and control, in terms of risk communication, in terms of contact tracing, so many aspects of the response. Health workers at both the secondary, primary, and tertiary level of care were really, their skills and capacities were really built. In fact, I would say the success again is how much and how far we are able to move this manpower at the 3 levels of care, how much we are able to transfer skills, knowledge, changing attitude to the entire response. So I would say we have done quite a bit, and most health facilities in Kano at one point or another, they had one capacity building or another, and through the National Primary Health Development Agency, the NCDC, we were able to train at least one health worker in each of our over 1,200 facilities in Kano, which is a huge number. We trained over 2,400 personnel within a space of 2 weeks, which again is impressive. So all parts of level of care were touched.
Okay, so while we're training personnel and we're developing human capacity, so are we seeing a synergy on the upgrade of facilities, equipment available? Are we talking the availability of BSL level 2, level 3? We know the BSL level 4 labs cannot be just established everywhere, but are we seeing an upgrade in our lab, in our testing capacities, in the universities? Is there synergy? Are we having labs, molecular testing laboratories springing up in health facilities, in research facilities? So that's, is that happening as well?
Yes. When we started this outbreak response in Kano, before the age of April 2020, there is no single lab in Kano that is testing COVID-19. And as I'm speaking with you right now, there are 5 laboratories in Aminu Kano Teaching Hospital, which is an UK Biouniversity Kano, both of them tertiary institutions and research centers. We've seen also another lab in Africa, which and also IFN, that's International Federation Against Infectious Diseases in Nigeria, which is a research lab. We've seen COVID-19 testing being conducted. We also have seen another lab in Muhammadu Buhari. So what's that? Muhammadu Buhari Specialist Hospital. Yes. So there is that synergy. The capacity to test is not only domiciled with one segment of the level of care, but it's across the levels of care. And because of the synergy we have, we are able to work with Aminu Kano University, with research laboratories, independent research laboratories, with for-profit organizations, with several organizations. That synergy was created, and it's because of the environment, the conducive environment the state provides. This is why we are able to establish this synergy and engagement.
That's how you were talking about some ongoing researches on COVID-19. Can you give us a rundown on some of those, as in what is the core objective of one or two of those researches? Are they looking into vaccine production? Are they looking into molecular sequencing of the virus? Are they looking into the transmission, all those some aspects? What are the core objectives of the ongoing researches?
Yes, we are in an outbreak, so whatever that is of the outbreak, this research is focuses on them. One of the research is we are trying to see what genetic markers influence
the
severity of the disease. So we want to determine
like binding sites of the disease to the human cells. Okay.
Yes. So what are those factors that gives severity of the disease? We are also doing the risk perception of people, how people perceive their risk to COVID-19. Some of them actually knowledge actually and practice, because you want to find out how people behave and how you quantify your outbreak response. So most of these researches are centered around that, and there is the solidarity trial, the WHO trying to test to have a research involving treatment centers, not vaccine testing. There is no vaccine testing in Kano, but the treatment modalities, what treatment options are there. Some of these drugs, they have never been tested for COVID-19, so Kano centers, at least 2 of our isolation centers are part of that WHO solidarity trial. The trial looks at treatment options for COVID-19, and we are partaking in that. So several of these researches, and the whole aim is how do we improve patient treatment, patient outcome, receptivity of communities towards COVID-19, and also how do we improve coordination and efficiency of the response time.
Okay, thank you, sir. Welcome, sir. Now, lastly, sir, a message to the people on safety and precautionary measures.
There is this old English saying that says prevention is better than cure.
Yes, absolutely.
Yes, and prevention is much cheaper than cure, actually.
Yes.
How much it takes, how much it costs one to get to prevent himself from contracting COVID-19 is much simple. One, use of face mask. You can have cloth face mask. You don't need to wear the expensive medical face mask.
Yes.
You can use cloth face mask. Hand hygiene. You don't need to use that hand sanitizer.
Just wash your hands.
Just wash your hands.
Under running water. Yes, I think I'd like to buttress that. I want to use this opportunity. When I tell people that you have to wash your hands under running water, the truth is because if you wash your hands in a bowl, it's as good as, you go back with everything you put inside. So but the idea is to wash it under running water.
So that whatever is washed off.
Yes.
And preferably with a liquid soap. But even if you do not have a liquid soap, you can still use the bar soap, clean your hand, but ensure that it's under running water. This makes your hands safe and clean so that you don't, whatever you touch in your face, you are not
transmitting.
You are not putting it back to yourself.
Yes.
So that's the basic idea. Ensure that you maintain the social distancing.
Like we are maintaining social distancing.
The minimum of 6 feet. That's about 2 meters. So that there are researches that shows how far particles.
Yes, the air droplets of the virus.
Yes, how far they can move, and this is the minimum distance.
Okay, thank you so much, Dr. Tijjani, for your time. Thank you for finally having time to be on the show this evening.
Finally, I know that
you've been very busy, we understand.
Yes, I've been